And the subconscious will often keep a problem like that in place to get that benefit. And they would often resist changing because if the person gets over that pain or obesity or addiction or grief, then they may lose that benefit they get for having that problem. I want to, but the ambivalence is that sometimes people who have chronic states like chronic pain, depression, grief, obesity, there's a few others, but those are, situations where people are in it long term. It's usually very resistant to whatever they're doing to change, sometimes even hypnosis. And if they do change, they often relapse. Oh yeah, addictions, that's another one. They go back to it. So they have a fairly consistent, unhealthy, undesirable state in their life. And then try as they might, they can't consistently seem to change it. And very often that's due to something called secondary gain, which is really fascinating, which means they're getting a benefit for having their problem. So for example, someone who has back pain, they are obviously aware consciously that really sucks and it's limiting and all of that. But if it helps them not have to take out the trash, or it helps them get sympathy for their pain, so they avoid difficulty and they get attention or support, hey, that's a good thing. And the subconscious will often keep a problem like that in place to get that benefit. And they would often resist changing because if the person gets over that pain or obesity or addiction or grief or depression, then they may lose that benefit they get for having that problem. And this is not terribly common, but I do see that in some cases, especially if someone said, I've tried everything, or I had success for a little while. The person really does consciously want to change, but they're getting enough of a payoff that, it's like the devil you know versus the devil you don't. And so they stay stuck.